Hi, I'm Darnell Cox with Live Young Lifestyle, and today we're in the offices of Dr. Yamini at Sunset Cosmetic Surgery Center, and we're talking about CBD, medicinal cannabis products. So we're here today with Shannon Barnett, the founder of Sana Wellness, that is the one who's going to talk to us about these products. But how is this different than, you know, us going to a dispensary and getting stuff that's going to get us high? Is this anything that gets you high, or does it have other properties to it?
How this started, you know, was that I was a patient myself looking for cannabis products, right? Because I have a few autoimmune conditions, systemic lupus, Sjogren's, PCOS.
Wow.
And I'm really sensitive to medication. So when I found out what was wrong, it was nice to know the what, but I wanted to know what options I had.
What do you do?
Yeah, so that was kind of what spun me into going into the cannabis space. I wasn't really much of a recreational user before. It wasn't my bag.
Yeah.
But here I dove into, you know, doing some research, and I found CBD as something that was being used in different areas for treating conditions.
Okay.
So I wanted to go find that.
Gina, your dad is how old is he now? 85?
My dad's 85 years old and having some slowing down a little bit, problem with like metabolism and just weakness and pains, and so that's why I'm so curious to hear about this and what he should start on and the dose and the whole thing.
I wanted to ask you, Dr. Yamini, why do you find it that you're adding this to your practice now?
Over the last few years, I've noticed a lot of my patients are resorting to legal medical cannabis products for all sorts of conditions.
It's the hot new thing.
People use it for pain, for sleep, for stress, anxiety, just muscle relaxation. And most recently, I had some personal experience with it. I had a nephew who had brain cancer and required these type of products. And I have an aunt with ovarian cancer, pretty advanced, and they both really relied heavily on not the THC part that gets you high, but the anti-inflammatory and the anti-cancer components and the anti-nausea components of CBDs. So I wanted to learn a lot more.
Right.
So
and that's how you found Shannon.
That's how, through my patients, I found Shannon, who knows a lot about this.
So tell us about some of your products here, because we've got a whole array of products here.
We do.
What did you start with?
That is this, right?
Okay.
Here. So because I had a lot of things going on that were both internal and external, I wanted something that you could ingest and something that was topical. Because a lot of the times you would find a tincture or any sort of ingestible, and then you'd find topicals. And what would happen is I would look at the topicals and there would be significantly less cannabinoids. That would be the first thing. So if you go to topical and you get less cannabinoids, and then you get the addition of a bunch of essential oils and things like camphor, and you put things that people feel. They're like, oh, this must be working because it feels cooling.
Yeah.
And I always say you could go to the 99-cent store and get a patch, put it on, and you can feel the same sensation.
Vicks Vapor Rub.
Exactly. But if the star ingredient that you're going out to get, it's supposed to perform like nothing else, you shouldn't need to have all the other stuff. And you should really notice that difference.
Exactly.
And another important thing that I want to point out, as a physician, I'm really big on knowing dosing. I know we're going to talk about this later, but one of the issues that Shannon's really stressed with me is microdosing. Most of the products out there, even if they were tested and legal, we don't really know what the dose is. And a lot of people don't know what is the right dose to take care of your condition.
Right.
So that's one of the areas that Shannon's really focused, and I've learned from her, is we don't need to overdose ourselves with many of these components. And what I like about her brand and the way she promotes her products is that she really likes to quantify exactly how much of which key ingredients you're taking in.
Right. How is this different from hemp?
Because
there's a lot of topical ointments that say hemp.
I was taking a bunch of hemp CBD and not even knowing it, and for almost 3 years, I was getting worse. I wasn't getting better. My mouth, I was on my way to dentures, which is not an exaggeration when you don't have saliva.
Yeah, your teeth. That's
and you
exactly right.
You can't get implants. I found
you don't
that
know
was devastating.
you don't know how important saliva is until you don't have it.
Yeah, even for digestion. I mean, just for everything. So I was getting worse. And when I started making this, I mean, I naturally went for a strain that was rich in it, and then I found out that that's what people were doing. And so I'm like, well, why are people doing this? And in some cases, CBD derived from hemp isn't effective. It can be effective. The issue lies with the very, very narrow therapeutic window, meaning that you have a very small space of getting a accurate dose, and if you don't get that accurate dose, you are risking decreasing the actual therapeutic benefit, if not eliminating any analgesic or anti-inflammatory at all, right? So if you have that, that's a very hard task for something that what we know is that we have an endocannabinoid system. It's a big word.
That is a very big word.
Endocannabinoid system.
We will have the definition below.
It's basically the central processing system for our entire body.
So our bodies are meant to process
we
this.
produce
basically
endocannabinoids.
Okay.
Right? Which that was only discovered a little over 25 years ago, which if you think about that, it's like yesterday in medicine and science, right? Like that's not...
It's very new knowledge.
Endocannabinoids are what we produce, and then cannabinoids are what are found in cannabis. But when you think about a baseline of having opioid receptors, we know what those are, right?
Right.
We know opioid receptors. We have cannabinoid receptors. So anyone who's ever been on the fence or thought it was so, taboo or had the stigma with it, we're meant to receive it.
Right.
But the problem is, when it comes to dosing in the field, in dispensaries and other brands, what's happening is there's an adoption of the generalized dosing that happens in like traditional medicine, right? Where it's
like a one-size-fits-all.
Well, or if you're this age and this weight, we start you at this dose, and it's not really that individualized even at that level, but it kind of is made
and not
for
individualized for the particular problem that you're having.
And if I were to start at any point, start generalizing, oh wait, you told me your dad has this, this, and this, then definitely he's going to start with these 3 things, and he's well, that is not helpful, because if one thing works, we don't know which one worked, right? So this is the starter. This is the first thing I made.
And what is this one called?
So this is just called the oil.
The oil.
The oil. So it's a...
The oil.
The oil. So it's a non-psychoactive CBD dominant coconut oil, which I use Ringo's Gift and ACDC, which are 2 strains dominant in CBD, which is important. That means they have dry weight, so much CBD and very low THC.
Okay.
A microdose is a 0.25 gram dose of oil. What does that look like? A small pea size. Which another part for me was I never wanted anyone to feel like they were missing information. So everything comes with product inserts that has a picture of what that looks like on your spoon, right? And it comes with a little spoon because I think that's helpful, right? Things that help people.
Well, plus you don't want to contaminate the product. So like to be able to dip into it with a spoon.
Exactly.
And so is this rubbed on you, or how are you?
It's edible and topical. So I wanted one thing, again, that you weren't compromising cannabinoid content going to a topical. I have extremely sensitive skin. You couldn't tell now, but I had all of 2016. I had lupus lesions and sores all over my face and neck and in my scalp.
Oh, your skin looks beautiful now.
Which,
there you go.
It's on the skin.
And so with this, I'll just show you what it looks like. Definitely has a green
Can I
color
smell
to
it?
You can.
Yeah, let me smell it.
Ooh, I wouldn't say it smells like weed.
It does. It smells like pot.
It has a little bit of a marijuana scent to it.
And so, a small pea-size amount, that's your microdose.
Okay.
Now, what's in a microdose? 1.4 milligrams CBD, 0.04 THC.
And the THC is what makes you high.
The THC is the psychoactive. The CBD is the non-psychoactive, highly medicinal part of the plant.
The medicinal benefits that the CBD part provides without having any of the high or euphoria effects of the THC for my patients. And I think it's going to be incorporated in medical and surgical future.
Interesting.
So you can either eat that pea size, or
so you would just
put
that in
you
your...
can put it on topically, and you just would put it. If you want, you can try it. You can put it just right under your tongue.
I'm totally gonna try this.
And you just want to let it sit under your tongue. And the reason we want to do sublingual, let it sit just for about a minute. At least a minute, minute and a half. And what you're doing is you're letting it absorb in the second fastest route. Anything faster would be a hypodermic injection. So sublingual actually gets it into your system faster, bypassing the first pass in the liver. So you're really, especially with a little microdose, you're getting all of your microdose.
And sublingual, you're meaning under your tongue.
Under your tongue.
It has like a Vaseline consistency.
It's coconut oil.
It just melts away.
Yeah. It does. So it's not like a bad taste or anything.
No, it has a little bit of a nutty flavor.
Which is the non-GMO sunflower lecithin, and why I use that.
It's like sunflower.
And why I use that is because it increases the bioavailability, making it more readily usable by your
So I'm not going to crave a pizza in 10 minutes.
No.
Okay. And I put this under my tongue.
Under your tongue, yeah. So you can ingest it or you can use it topically, but I always say that it's really great to be able to attack things from the inside and the outside.
That's all about anti-aging.
Right, there is no flavor.
Right?
It's like a little,
It's easy. That's
It's
very
very
easy.
light and palatable.
Mine's already gone.
Right? So this, with a microdose, the unique aspect of it is that how many you will need in a day is going to vary. I have some patients that have been referred through pain management doctors that have been on narcotic regimens, and if I were guessing, be like, oh, they're probably going to need something stronger.
Right.
And I have one who's taken 1 microdose a day for months now, hasn't touched a pain pill. Everyone responds differently.
That's
Because
fabulous.
all that pain medication, you know, it's so highly regulated now, which it should be, because
And it's a big epidemic.
it is a huge epidemic.
Well,
I think it ages you. So to have something like this,
A non-narcotic
non-narcotic option, I think is fantastic.
Now, when it comes to also with the narcotics, is that a lot of people think, oh, well, if you have an addictive personality, you should stay away from the opiates, and it's not true. It's anybody, because
Anybody.
regardless of your addictive personality or not, if you are taking as prescribed for 3 days, I believe it is, the tolerance starts to build.
Oh yeah,
Right?
it starts right away.
Wow,
3 days. 3 days. Now, if you think about
Wow.
how often someone goes into the ER for a stub toe and leaves with the 30 quantity, that's enough to get
Yeah.
them. And what happens is very quickly, that's the tricky thing about the opioid receptors, is that they blur the line very quickly in that 3 days. They go, you're feeling pain, and you don't know
Yeah.
if it's
Right.
real or not.
So do you think
And-
you're going to be prescribing some of this stuff for like post-surgical
Yes, I think we're
procedures
going to
for
be
pain?
incorporating this
Incorporating
as a adjunct or a help to traditional painkillers. Obviously, after major surgery, you're going to need some strong
Yes.
painkillers.
Yes.
But to make sure our patients don't get addicted to it,
Yeah. When they ask for the refill,
Well, no,
So
no. For
make
when they
this for a
start,
suggestion.
when they start with it, and when you take, and here's a fun fact. So this whole thing of 3 days, right?
so you could do it in conjunction.
If
You would do it in conjunction.
Yes.
Okay.
It's a very, very complementary option to not just opiates, but also to just treatments and things. It's complementary.
and it helps the entire recovery system.
Right.
Not just kills the pain.
Not just the pain.
It helps with the inflammation. It helps with your immune system. It helps fight infections. It helps your
Wow.
entire regulatory system of your body, kind of like the operating system of your computer. We have receptors for these products throughout all our organs, even our skin and our brain. So this
Interesting.
helps, even at a very small dose, helps the entire system function smoother and more effectively. So you'll rely less on prescription medications.
Yeah.
But listening to this, is this something that my father should be taking like every single day?
Yes. So
I mean-
microdosing consistency is key.
Okay.
About every day, and the great thing is there's a short-term benefit, right? So if you're taking it for, let's say, anxiety, right? You take it and you're getting anxiety relief. But every single dose you take also builds cumulatively in your system to improve the overall tone of your endocannabinoid system. So when we look at what this system regulates, there's nothing that it doesn't touch. Every major system in your body.
Okay, so
I think everybody should be taking this every day.
Yes.
I mean, regardless if you have any problems or not,
I
to
feel
avoid
like
them.
it's the most, like the best prophylactic anybody could do for preventative of a lot of different things.
Sign me up.
condition.
yeah,
I'm in.
I'm already
I'm
kind
in.
of sold. But let's just go through the other products real quickly. What else do you got here?
Because coconut oil liquefies at 78 degrees, doesn't make it a good road jar. You're not throwing this in your purse. It'd be a
Right.
mess, right? It
Right.
liquefies. So I made it in a capsule form, which is over here. So you have these tiny little microdose. So one capsule is one microdose.
That's
So it
fantastic.
has,
That's awesome.
and I don't like big capsules, so I committed to the
Yeah.
tiniest ones possible.
I like
Vegetarian
that.
capsules, they dissolve under the tongue.
Perfect.
Or you can swallow them. I then
Oh, so that capsule dissolves under
Yes.
the tongue.
Just melts.
uh-huh.
That's great.
Yeah,
That's
and
great.
then again, everything being strain specific, this one is just the stronger version of the oil, CBD plus. This
Okay.
is the key, the game changer for all my autoimmune chronic inflammation, my perioperative patients, before and after, to speed up surgery recovery, because inflammation is the biggest thing that delays it, right?
Well,
So-
and inflammation is like the root of all illness and of aging. So
Yeah,
anytime
yeah.
we can
Keep it down.
take,
right?
take
Whether it's
something that decreases inflammation, that's good.
whether it's an elective procedure or non-elective, it just supports your system.
Uh-huh.
And then I did the black label, which I added, so it has Ringo's Gift, ACDC, the same strains, but then I picked Granddaddy Purple. Every strain I've picked is specific for a reason, because of the
Okay.
terpene profile. There's a terpene profile with each strain, and that terpene profile is a roadmap of the additional benefits beyond the cannabinoids themselves.
Okay.
While most of the stuff is non-psychoactive, for people who can't tolerate or choose not to do the narcotic medications, there are alternatives within the line and through consultation. Now, there is the bath bomb, which is an experience, but it really does help. And when people have done it, they're like, oh my goodness. And this has the oil in it. So the oil here is the base for the everything balm, for the bath bomb, for the skincare, for the scrub, and it is in the bath bomb. And then there's Epsom salt, apple cider vinegar, frankincense, myrrh. It's pretty much the most relaxing, amazing, still non-psychoactive, but just super relaxing. Good for psoriasis,
and
eczema.
what's the spray?
This is the skincare that's coming out soon, but this is the everything spray. So you can use it as a primer, as a makeup setter to refresh your skin. You could use it on a burn. You got rose water, hyaluronic acid, also infused with the CBD. And same with the skincare. It's all, you know, cruelty-free, paraben-free, phthalate-free, no synthetic fragrances. And the scrub is a CBD, manuka honey, coconut oil, sugar scrub. You want to smell something delicious.
Sign me up.
Oh my gosh.
Ooh, yum.
Oh, yum.
Brown sugar.
Brown sugar.
Smells like brown sugar.
And so what you're doing is as you're scrubbing, is you're depositing the CBD and manuka honey into your skin, leaving a really good barrier of protection. So if you have irritation from shaving, or if you have, you can use it on psoriasis, you can use it on acne, on sensitive skin, and it just works. It's like replenishing your skin as you're scrubbing.
Okay, so tell us where our viewers can see all of these products and learn more about you. Where would they go?
They could go to sanasanawellness.com, which I believe will be put in a little banner.
Down here.
So sanasanawellness.com is a place you can go down a rabbit hole as far as you want for education, unbiased articles and studies, and product information. And all the lab tests are there. Everything you want to know about the products and me, and consults and questions are encouraged. So
Great.
Yeah.
So finding these alternative medicines to be able to fight inflammation and to help with chronic illnesses and pain relief in a healthy way that's more anti-aging, I think that is a really good way to live young. Thank you so much. This was fantastic. Thank you.